Let's dive right into this explainer on business ethics. Today, we're taking a really close look at the global compliance landscape governing the medical equipment and supplies industry. If you work in this space, navigating healthcare fraud and abuse laws, well, it's not just some legal check-the-box exercise. It's literally the bedrock protecting our integrity and ultimately our future. So let's unpack exactly how international standards view what we do every single day. Here is our quick roadmap for today. 1. The business ethics landscape. 2. Bribery, corruption, and losses. 3. Defining healthcare professionals. 4. Enforcing codes of ethics. And 5. Protecting enterprise viability. Let's get to it.
Section 1. The business ethics landscape. Navigating global fraud and abuse laws.
I really want to anchor us to the source text from the Sustainability Accounting Standards Board, or SASB. This brilliantly illustrates the incredibly high stakes we're dealing with. Listen to this carefully. Compliance failures can have notable effects on enterprise viability, right? In our industry, a failure doesn't just mean a slap on the wrist. It's not just a simple fine. It threatens our reputation and our very survival as a functioning enterprise.
What's super interesting about the SASB framework is how it categorizes our accountability into two distinct but deeply connected metrics for business ethics. We've got HMS 510A.1, which deals with monetary losses from legal proceedings, and then right alongside it, 510A.2 focuses on the codes of ethics governing our interactions. So one measures the consequence, while the other measures the prevention.
Section 2. Bribery, corruption, and losses, the cost of non-compliance.
Here, we're contrasting the reactive cost of compliance failures against our proactive preventative shield. Metric 1 is tracking those actual quantitative monetary losses from bribery or corruption. Metric 2, well, that's our internal code of ethics. The whole goal of corporate compliance is actually pretty simple. We want to ensure the robust systems we build under Metric 2 prevent us from ever having to report a single dollar under Metric 1. Makes sense? The crucial thing to remember here is that these monetary losses cast a massive net. When the standard talks about losses from bribery or corruption proceedings, they mean civil judgments, regulatory penalties, disgorgement of profits, and criminal restitution. And here is the real kicker. This metric entirely excludes legal defense fees. So the monetary loss reported to investors hits the bottom line directly long before we even start accounting for the millions spent on lawyers defending the case. Now, if a violation does happen, the standards demand absolute transparency. You can't just pay a fine and quietly sweep it under the rug. The reporting entity has to publicly describe the nature of the judgment, provide the full context, like, was it fraud, was it bribery, and disclose specific corrective actions. This could mean a total overhaul of operations, firing and replacing management, dropping business partners, or bringing in entirely new training technologies. Basically, regaining trust requires bearing it all.
Section 3. Defining healthcare professionals beyond the exam room.
Think about it for a second. When you hear the phrase healthcare professional, who actually pops into your head? You probably assume it just means the surgeons wielding our instruments, or the nurses using our equipment in the exam room, right? But is that really the whole picture when we're talking about compliance risk?
Actually, no, not even close. This definition is absolutely vital to grasp. Yes, the standard includes care providers like doctors and dentists, but it explicitly adds anyone who purchases, leases, recommends, or prescribes our products. We're talking purchasing agents, practice managers, and those massive group purchasing organizations, or GPOs. They are all bound by the exact same interaction rules. So compliance applies equally whether you're buying lunch for a chief of surgery or a hospital supply chain manager who never even sees a patient.
Section 4. Enforcing codes of ethics, turning policy into action.
The standard dictates that our code of ethics has to explicitly regulate the gray areas of corporate relationship building. We're talking about daily interactions that might seem like totally standard business practices in other industries, but are heavily scrutinized in medical supplies. The code must dictate exactly what we can spend on food and entertainment, how we conduct and fund educational seminars, and the strict rules around participating in committees that set formularies. Honestly, there is zero room for ambiguity here.
So, let's see how this translates into the mandatory mechanisms the source actually requires us to maintain. Because a code of ethics is just a piece of paper if you don't enforce it. The standard outlines 3 key steps. First, active enforcement through dedicated compliance and review committees. Second, swift corrective action if that code is ever violated. And third, continuous mandatory training. And this isn't just a check-the-box exercise either. The standard specifically requires tracking the exact degree and frequency of the training for all staff.
Section 5. Protecting enterprise viability, a shared responsibility.
Looking at these scenarios, it becomes crystal clear that every single daily action carries real weight. Take improper entertainment of a GPO, and remember, they count as healthcare professionals under the rules. Doing that can directly trigger bribery investigations and those massive fines we discussed earlier. But the preventative mechanism is entirely in our hands: strict adherence to the code. What about inadequate oversight? That leads to reputational damage, which we prevent through internal audits. So you see, every risk has a direct line to a severe consequence, but it also has a clear, actionable mechanism for prevention.
I want to leave you with this final thought as we wrap up this explainer. Corporate compliance isn't just some abstract department down the hall. It's built on the foundation of every single email you send, every meeting you host, and every contract you negotiate. Your everyday decisions are the actual, living enforcement of these global ethics standards. So, looking at your own role, what will you choose to do to protect our enterprise today?